My name is Kamleshgiri. I work with Care International. I'm here in the refugee camp in Balukhali in Cox's Bazar. We have just started a primary healthcare center at this refugee camp, which is right behind me here. We had lots of patients this morning. We had more than 70 cases who were examined and treated here today. There are a number of cases who are waiting as we speak right now. We have a number of women patients who are here. We have a number of children cases who are waiting here. They move through the clinic, they get registered, they get counseled by the paramedic and examined by the paramedic. All the patients who come to this clinic get the registration here. We also have a paramedic who provides a patient checkup as well as provides treatment for the patients. She also provides counseling services for nutritional counseling, for family planning counseling, and other counseling services that might be needed here. This has been going on for the whole day today. So it's a very busy place and we expect that this will continue even more as we go forward in the coming weeks. Most of the cases are managed by the paramedic here. However, sometimes when the cases are more complicated, she would refer the case to our doctor who also sits at this clinic. She's told me that she has seen a lot of cases today. Most of them are antenatal care cases, but then there are a lot of children who come in here with diarrheal diseases as well as respiratory tract infection cases. So those are predominant case burden in the camps overall. So one interesting thing that the doctor also told me was there were 2 postpartum cases that she has seen here, and both of them actually delivered this morning, and both of them came here because the bleeding was not stopping. In one case it was because of retained placenta, in the other case it was because of perineal tear. So at this moment we are not fully functional to provide those basic emergency obstetric care services at this place. But as we move forward, we would definitely like to introduce basic emergency obstetric care so that those cases can be managed properly, adequately at the care clinics, at the camps. So as we move forward in that direction, we continue to serve the community here with the required antenatal care and other reproductive health care services, along with care for children as well as for men and boys who come in for the services. There is a huge task at hand in bringing good quality primary health care and reproductive health care services to the camps. There are many stakeholders who have been working very hard to bring these services, and CARE is at the forefront to also bring these services to the refugee population. Our services are focused on bringing services to women and girls as well as children under 5, but also for men and boys who come to get our services. We hope to expand our services to more camps with more services, especially bringing in emergency obstetric care services to more places, because we have recognized that as one of the gaps in the camps. We also have plans to continue this beyond the immediate response phase, as we know that the need for this refugee population is going to be here for quite some time, because there are more than 600,000 refugees currently residing in different camps in Cox's Bazar. So we, as CARE, we would like to bring as much as possible the services required, especially for women and girls, who we know have got larger burden of disease as well as of other causes that could lead to more serious conditions which may not be apparent at this point. So we are here and we would like to continue these services for more time to come.